Welcome to this presentation on maternal health. This presentation was created by Clara Lerma, Lindsay Stewart, Alejandra Melendres, and Christy Wisbeck for Nursing 508.
Maternal health refers to the health of women during pregnancy, childbirth, and the postpartum period. These stages include significant physical, emotional, and social changes, and they require appropriate medical care and support to ensure both maternal and infant well-being. Maternal health care includes several components. Prenatal care, which monitors the health of the mother and developing fetus during pregnancy. Safe childhood practices ensuring skilled health professionals assist during labor and delivery, and postpartum care which supports recovery and monitors complications after birth. Although pregnancy and childbirth are natural processes, they can still involve serious risks. Complications such as hemorrhage, infection, preeclampsia, gestational diabetes, and postpartum depression can significantly affect maternal outcomes. When discussing maternal health, certain groups are considered vulnerable populations because they face increased risks for poor maternal outcomes. A vulnerable population refers to a group that experiences a higher likelihood of health disparities due to social, economic, environmental, or systemic disadvantages. In the context of maternal health, vulnerable populations may include women living in low-income communities, women without health insurance, women living in rural or medically underserved areas, racial and ethnic minority groups, particularly Black and Indigenous women, immigrant populations, and women with limited access to transportation or stable housing. It is important to understand and examine the characteristics of maternal health as a vulnerable population. These characteristics can be divided into demographic, sociocultural, and socioeconomic factors which play major roles in maternal health outcomes. Demographic characteristics include age. Two groups are considered higher risk: teen mothers who may face social stigma, limited financial resources, and incomplete education, and older mothers aged 35 and above who may experience higher risks of complications such as hypertension, gestational diabetes, or chromosomal abnormalities. Both groups may require additional monitoring and support throughout pregnancy. Race and ethnicity also plays a significant role in maternal health outcomes. In the United States, racial and ethnic disparities are well documented. For example, Black and Indigenous women experience significantly higher rates of maternal mortality and pregnancy-related complications compared to white women. These disparities are often linked to structural inequalities, implicit bias in healthcare, differences in access to quality prenatal care. Additionally, some ethnic minority groups may face barriers such as language differences, discrimination, or limited health care coverage, which further increase risks during pregnancy. Socioeconomic status has a major impact on maternal health. Women with lower income levels may experience limited access to prenatal care, lack of health insurance, transportation barriers, food insecurity, poor housing conditions. These social determinants of health can lead to delayed prenatal care and increased pregnancy complications. Geographic location. Where a woman lives also affects maternal health outcomes. Women living in rural or medically underserved areas often face challenges such as fewer hospitals with maternity services, limited access to obstetricians and specialists, longer travel distances for prenatal care. These barriers can delay treatment and increase the risk of pregnancy complications. Urban areas may have more healthcare facilities, but vulnerable women in cities may still face challenges such as poverty, overcrowded clinics, or limited insurance coverage. Marital or partner status. Support systems also influence maternal health outcomes. Women who are single or lack a supportive partner may face financial stress, emotional strain, and increased caregiver responsibilities. Partner involvement often improves maternal well-being by providing emotional, financial, and physical support during pregnancy and postpartum recovery. Sociocultural characteristics. Cultural beliefs and practices influence how pregnancy and childbirth are perceived and managed. For example, some cultures emphasize home births or traditional healing methods. Postpartum practices such as extended rest periods or special diets may be important cultural traditions. Healthcare providers must respect these beliefs while ensuring that mothers receive safe and evidence-based care. Language barriers can significantly impact maternal health. Women who are not fluent in English may struggle to understand medical instructions, communicate symptoms, or navigate healthcare systems. Without proper interpretation services, these barriers can lead to miscommunication, delayed treatment, and lower quality care. In some cultures, gender roles may limit a woman's ability to make healthcare decisions independently. For example, a husband or elder family member may control decisions about seeking medical care, and women may prioritize family needs over their own health. Limited autonomy can delay prenatal visits and increase risks during pregnancy. Immigration status. Immigrant women often face additional challenges when accessing maternal health care. These challenges may include fear of deportation, lack of health insurance, limited knowledge of available services, and cultural differences with healthcare providers. These barriers may prevent women from seeking timely prenatal or postpartum care. Mental health stigma. Mental health is a critical component of maternal health, especially during the postpartum period. However, stigma surrounding maternal health may prevent women from seeking help or conditions such as postpartum depression, anxiety, and stress related to pregnancy or motherhood. In some cultures, mental health struggles may be seen as a sign of weakness, causing women to suffer in silence rather than accessing care. Socioeconomic factors strongly influence maternal health outcomes. These factors determine a woman's ability to access healthcare services, maintain a healthy lifestyle, and receive adequate support during pregnancy. Income plays a major role in maternal health. Women with lower incomes may struggle to afford prenatal visits, healthy food, prenatal vitamins, and transportation to healthcare appointments. Financial stress can also contribute to poor mental health, chronic stress, and increased risk of pregnancy complications. Low-income mothers may also delay or skip prenatal care due to financial barriers, which can lead to undetected complications. Education is closely linked to maternal health outcomes. Women with higher levels of education often have greater knowledge about pregnancy health, better understanding of medical recommendations, and improved ability to navigate healthcare systems. Education can also influence health behaviors such as nutrition, smoking cessation, and adherence to prenatal care. Conversely, women with limited education may face challenges understanding medical instructions or recognizing warning signs during pregnancy. Health education programs can play an important role in addressing these gaps. Health insurance coverage is another key determinant of maternal health. Women without insurance are significantly less likely to receive early and consistent prenatal care. Even among insured women, the type of insurance can affect access to providers and services. For example, some providers may not accept certain insurance plans, or coverage may not include all necessary maternal services. Programs such as Medicaid play a critical role in providing maternal health care coverage for low-income women. However, gaps in coverage before and after pregnancy can still affect access to care. Employment status can also influence maternal health. Women who work in low-wage or physically demanding jobs may face additional risks during pregnancy. Some challenges include lack of paid maternity leave, limited flexibility to attend prenatal appointments, physically strenuous working conditions, and/or job insecurity. Without workplace protections, pregnant women may continue working under stressful conditions that negatively affect their health. Supportive workplace policies can help improve maternal outcomes. Transportation is another important but often overlooked factor. Pregnant women who lack reliable transportation may miss prenatal appointments or delay seeking medical care. This issue is particularly significant in rural areas and low-income communities where public transportation options may be limited. Missed appointments can prevent early detection of complications, increasing risk for both mother and baby. Programs that provide transportation assistance can help improve access to maternal health care. Housing stability also plays a significant role in maternal health. Women who experience housing insecurity or homelessness often face increased stress and limited access to healthcare services. Unstable housing conditions can also expose pregnant women to environmental hazards, poor sanitation, and unsafe living environments. These factors can contribute to complications such as premature birth and low birth weight. Safe and stable housing is therefore an important social determinant of maternal health. When studying vulnerable populations, it is also important to consider both emic and etic perspectives. For emic perspectives refers to the insider's viewpoint, how individuals within the population perceive their own experiences, beliefs, and health practices. For example, a pregnant woman from a specific cultural community may view pregnancy as a natural process that does not require frequent medical intervention. She may rely on family traditions or community support rather than formal healthcare services. Understanding this perspective helps healthcare providers appreciate the cultural values and lived experiences of patients. An etic perspective, on the other hand, refers to the outsider's viewpoint, typically that of researchers or healthcare professionals. From this perspective, maternal health is evaluated using medical guidelines, statistical data, and standardized healthcare practices. While the etic perspective is important for identifying health risks and implementing evidence-based care, it may overlook cultural beliefs or social realities that influence patient behavior. Effective maternal health care requires balancing both perspectives. Healthcare providers must use medical knowledge to ensure safe practices while also respecting and understanding the cultural context that shape patients' decisions. When both perspectives are integrated, healthcare systems can provide more culturally responsive and equitable maternal care.
The social determinants of health model illustrates how conditions in which people are born in, grow, live, and work influence health outcomes. These determinants significantly shape maternal outcomes. They also have major impact on people's health, their well-being, and quality of life. Some key components of this model is economic stability. So in that, employment plays a big part, income of those individuals, expense of how much they're spending, the debt they have, medical bills, and the support they have. The other key components are education access and the quality. So that consists of early childhood development, enrollment in higher education, high school graduation also plays a big part. Language may be barriers or even like literacy. Another key component is healthcare access and quality. So do these individuals have access to healthcare, access to primary care, and health literacy? Another component is neighborhood and the built environment around them. So access to housing, transportation, safety, parks, playgrounds, walkability to places, and where are they residing, so their zip code. Other components are social and community context, which consist of social integration, support systems. So do they have family that can help each other? Community, how's the community engagement, and the discrimination. Those are all key components of the social determinant health model. Dominant health issues in maternal health include maternal mortality, severe maternal morbidity, hypertensive disorders, gestational diabetes, preterm birth, and low birth weight. And moms also have health issues in hemorrhaging, and also mental health disorders. Health disparities in maternal health consists of many things. The first thing that I'll go over is racial and ethnic disparities. One of the most significant maternal health disparities is related to race. African American women in the U.S. are about 3 to 4 times more likely to die from pregnancy-related causes than a white woman. They also experience higher rates of severe maternal morbidity, life-threatening complications, preterm birth, preeclampsia, and hypertension. And these disparities persist regardless of education or income level. And some contributing factors of this is implicit bias and discrimination in healthcare, chronic stress from systemic racism, differences in quality of care, high rates of underlying health conditions are also contributing factors to racial disparities. And for geographic disparities, we're doing rural versus urban. So women living in like rural areas face unique like maternal challenges because there is like fewer obstetric providers and maternity hospitals just around them. And many rural hospitals have closed labor and delivery units. And when mothers deliver in these hospitals, like there is also like limited access to specialists or high-risk pregnancy care. So if they are in need of like care because something occurred, that can also play a part in mortality. Long travel distances to prenatal or emergency care may also affect this. The consequences to this are, like mentioned, delayed prenatal care, increased maternal complications, and higher maternal mortality rates in these rural regions. So in another disparity is socioeconomic disparities. So women with lower income or limited financial resources often experience barriers to care. These challenges may include the lack of health insurance, inability to afford prenatal visits or medications. Transportation barriers are also play a part in a barrier to get to their appointments or to reach out for help. Limited paid maternity leave is also a factor. Food insecurity and unstable housing also plays a part. And all these factors increase the risk for poor prenatal care, pregnancy complications, and poor birth outcomes. So it's very important that these individuals get all the help they need. Also, insurance and healthcare access is also one of the disparities. So access to health insurance significantly affects maternal outcomes. So women who are uninsured or underinsured may delay prenatal care. And because they want to stretch as much as they can, gaps in postpartum coverage can lead to untreated complications. So they might not even notice certain things that are that they need to seek help for. Medicaid patients sometimes experience limited provider availability. So that's also an issue. Scheduling appointments, they're farther apart. Another disparity is language and cultural barriers. So this is more effective in immigrant or non-English speaking women that these individuals may experience. Difficulty communicating with healthcare providers, that's another issue. So maybe they're miscommunicating, the lack of culturally competent care, and limited access to health education materials. This can lead to, as mentioned, miscommunication, delayed care, and poor outcomes just in general. Another disparity is age-related disparities. Maternal risks increase in certain age groups. So adolescent mothers may have limited prenatal care and higher risk of low birth weight infants. And also like older mothers, 35 ages and above in age, have higher risk of gestational diabetes, hypertension, cesarean delivery, and just more array of complications through pregnancy and even when delivering. Chronic health conditions are also a disparity in maternal health. That's briefly mentioned in the previous slide. So certain populations have higher risks of conditions that affect pregnancy. So hypertension, diabetes, obesity, and cardiovascular diseases. And these conditions increase the risk of severe maternal morbidity and mortality. Postpartum care disparities are also prevalent. Many women, especially those from underserved populations, face challenges after childbirth. So limited postpartum follow-ups, lack of mental health support, poor access to lactation services. So sometimes they don't have, maybe they need help with how to feed their baby. And all of this has, increases risk for postpartum depression, untreated medical complications, and readmission. So it's very important that doctors are asking questions during their appointments, and hopefully mothers feel inclined to reach out for help, ask for help in everything. The picture that I have on the side here, it even says deaths per 100,000 births. Total are 16.7. But the majority of these deaths are in the African American community. That's 40.8 and 29.7 in American Indian and Alaskan Native. Asian Pacific Islanders 13.3, white is 12.7, and Hispanic 11.5. And it says pregnancy-related mortality ratios are 3.2 times higher for Black women and 2.3 times higher in American Indian Alaskan Native than for white women. So it's just very important that we are aware of these disparities and that we can further help these individuals and just pregnant women in general. Genomic and biological considerations include the role of epigenetics and chronic stress. Chronic exposure to stress can alter gene expression, and epigenetic changes may increase susceptibility to conditions like hypertension, and cardiomyopathy may be exacerbated by limited preventative care, poor nutrition, chronic and psychological stress. Genomic and biological considerations. Substance use is a genomic vulnerability in some populations. So higher rates of substance use in some vulnerable populations are linked to trauma. So a lot of individuals may have experienced trauma from when they were younger and also in adulthood. And mental health disorders may have developed throughout the years. And also environmental stress also plays a part of high rates of substance use. And a lot of the times mothers or their upbringing can be a very unhealthy way to cope with their trauma or what they're going through, and there's just more prevalence of substance use because of that.
Maternal health risk factors include chronic conditions that increase the risk of complications during pregnancy and birth, chronic hypertension, renal disease, obesity, type 1 or type 2 diabetes, cardiovascular disease, and mental health disorder. Pre-existing medical conditions increase the risk of complications during pregnancy and birth. Cardiovascular disease is a leading cause of pregnancy-related deaths in the U.S. Obesity increases the risk for gestational diabetes, preeclampsia, thromboembolism, and a C-section delivery. Maternal health risk factors of health behaviors that influence pregnancy outcomes are related to tobacco and alcohol use, substance use disorder, poor nutrition, and inadequate prenatal care. Behavior and psychosocial risk factors influence pregnancy outcomes. Racial disparities persist, with Black women experiencing higher maternal mortality rates compared to white women, even after controlling for socioeconomic status. Maternal health risk factors. Social determinants of health play a major role in maternal outcomes, including poverty, housing instability, food insecurity, intimate partner violence, chronic stress, and limited access to health care. Priorities for maternal health care include early and continuous prenatal care. Early risk screening and management of chronic disease reduce adverse outcomes. Improve screening for hypertension and cardiomyopathy during pregnancy and the first year postpartum is critical. The postpartum period up to 12 months is a high-risk window. Expanded Medicaid coverage to 12 months postpartum has been associated with improved continuity of care. Screening for food insecurity, housing instability, and intimate partner violence is essential. Current programs improving care include Alliance for Innovation on Maternal Health that develops patient safety bundles, including like a hemorrhage and hypertension protocol. Implementation across hospitals has reduced severe maternal morbidity in participating states. NURS Family provides home visits to low-income first-time mothers. Research demonstrates reductions in preterm birth, improved maternal health behaviors, and long-term child outcomes. Centering Healthcare Institute promotes group prenatal care. Studies show reductions in preterm birth rates and improved patient satisfaction, particularly among Black women. States that extend Medicaid to 12 months postpartum mothers show improved access to mental health and chronic disease management services. Perinatal Quality Collaboratives is state-based collaboratives that use data-driven quality improvement models to reduce hemorrhage, hypertension complications, and racial disparities. Implicit bias and racism impact on mental health. Black women in the U.S. are approximately 2 to 3 times more likely to die from pregnancy-related causes than white women. Disparities persist across all education and socioeconomic levels, meaning higher education does not eliminate this risk. Even highly educated Black women experience worse maternal outcomes than white women, including these contributing factors that are delayed diagnosis of complications, dismissal of reported symptoms, an undertreatment of pain, and fragmented postpartum care. Implicit bias and systemic racism continue to significantly influence maternal health outcomes in the United States. These factors contribute to disparities in care delivery, communication, and clinical decision-making. Black women in particular are more likely to have pain and complications underestimated or misinterpreted. This can result in delayed diagnosis of preeclampsia, hemorrhage, or infection. Structural racism contributes to unequal access to high-quality prenatal and obstetric care. Implicit bias may affect clinical decisions, timelines of interventions, and escalation of care during emergencies. These disparities contribute to higher rates of severe maternal mortality and morbidity. Experiences of discrimination or dismissal in healthcare settings can erode trust between patients and providers. Loss of trust can negatively affect the therapeutic relationship and patient engagement in care. When trust in the healthcare system is diminished, individuals may delay or avoid seeking care. This can cause unmanaged complications and adverse maternal and infant outcomes.
This slide refers to various nurse strategies that can be utilized for maternal health. Our role is to advocate for policy reform, early identification of high-risk pregnancies with or without known health issues, become and provide patient trauma-informed with culturally competent care, participate in different improvement initiatives, and lastly, to have community engagement along with empowering women with resources and education provided. This slide refers to low literacy, which leads to delayed prenatal care and poor disease management and preventable complications in maternal health. It is important for nurses to use cultural, appropriate prenatal educational material and use layman terms to describe health information provided to patients and ask for take back or return explanation to confirm understanding. In this slide, as you can tell, it has Moreno Valley Unified School District emblem on it. And this is the field visit that I did. It's a community-based resource, and it's called the Wellness Center at Moreno Valley Unified School District. I received a comprehensive list of shelters with locations, addresses, hours of operation, websites, and specific services, such as a pregnancy test, for example, and where it can be achieved at.
For my field visit, I went to the Ontario Health Center, which is one of 4 federally qualified health centers in San Bernardino County. They have various services, including primary care for general medical care and health screenings, pediatric care for well child exams, sick visits, school physicals, and immunizations. They also provide prenatal care for pregnant women and include reproductive health services as well, which includes pregnancy testing, counseling, birth control, and emergency contraception, as well as PAP and breast exams. They also provide family health services, which includes referrals for children up to age 20, early prenatal care for low-income women, resources for families coping with sudden infant death syndrome, referrals for tobacco, alcohol, and drug cessation services for pregnant women. They also provide free home lead inspections. Located at this office, there is the Women, Infants, and Children's program. They provide supplemental benefits for food and nutrition, breastfeeding support, and referrals to other community services and other resources. This is where I got a lot of resources, including breastfeeding support, access to pumps for postpartum women, and help with getting formula for those who are unable to breastfeed.
The community resource that I visited is Rachel's Women's Shelter in San Diego. The mission and purpose of Rachel's Women's Shelter is a dedicated shelter for unhoused women, including during pregnancy. They provide a safe and supportive environment for women with few or no resources. The shelter serves women experiencing homelessness and related challenges, including trauma, lack of stable housing, and extremely low income. Support services include resource specialists and case management, behavioral health support, and mental health screening. Referrals to connection to community resources. Connected continuum of care, including transitional programs focused on moving women toward housing stability. This facility serves 100 to 120 women daily, 365 days a year, often serving as an entry point into broader services for these women.
The maternal community resource that I visited was Planned Parenthood. Planned Parenthood offers services on prenatal care referrals, postpartum health, and reproductive health support. Their mission is basically centered on providing reproductive and sexual health care, education, and also advocacy. The resources that they provide is during pregnancy, they do pregnancy testing, like labs and ultrasounds to confirm pregnancy and also estimate like the gestational age. They also offer non-judgmental counseling about pregnancy options such as continuing the pregnancy and parenting, and also adoption and abortion options are also offered, and prenatal care referrals to the OB/GYNs, midwives, or prenatal clinics. They also offer help to connect to people to Medicaid or prenatal clinics to provide information on other local support services for them. During pregnancy, they also offer STI and health screenings during that time, and STI testing and treatment, pap smears, tests, and basic reproductive health care. After birth, postpartum care. Postpartum checkups are offers like basic reproductive health exams, cervical cancer screenings, and breast health checks as well. Full postpartum OB care usually happens like with the hospital or an OB provider, so that's something that they don't offer. Postpartum birth control is also offered. So there's different array of birth control, your pills, your IED, so different options that they offer at Planned Parenthood. STI testing and treatment is also available after pregnancy. Mental and sexual health support. They may help with postpartum sexual health questions, pain with sex after birth, libido concerns, and referrals to postpartum depression or mental health care. And I think that's very important too, because a lot of women, it's hard for them to reach out for help. So I think it's important to offer these resources, because sometimes I know as a mom, we just want to try to do everything we can before we even ask for help, or at least some moms. But it's very important that we really take in considerations these resources, and moms are actually reaching out for these resources and making sure the providers are asking these important questions to be able to help them.